Hey everyone, my name is Different, and today I'm shining a light on the all-important mental illness. Health is defined as complete physical, social, and mental well-being. It's then unfortunate how often we neglect the all-important mental health. Joining us today is Dr. Aktor, who is a senior resident psychiatrist. Thank you so much for taking time out to listen to you. First of all, can we start by breaking two of the most prevalent stigmas? There's this fear that going to a psychiatrist also means a point of no return, it means complete lockdown. Could you enlighten us as to what kind of care is provided for them at psychiatric hospitals?
Thank you very much for having me. In the psychiatric hospital, our focus basically is to take care of patients who have mental health illnesses. And we do this via the inpatient and outpatient facilities.
What's the difference between the two?
Inpatient, patients who are on admission, and outpatient, the patients who see in the outpatient clinics.
Okay.
So the focus for the inpatients is for symptom remission. You know, they come in with florid symptoms, hearing strange voices, believing there's someone in the village running after them.
The typical.
Typical picture in the African context, the Nigerian context. So delusion. So our aim in the inpatient and for patients on admission is to take care of the symptoms.
Okay.
So focus is symptom remission. Then for the outpatient facility, it's at least for them to be discharged to the outpatient. That means the florid symptoms are taken care of. So the aim is relapse prevention.
So there's a possibility to be taken care of and leave the facility.
Oh, most definitely.
It's not a fine, because that's how Nigerians view. That's why there's that fear.
And that's what I'm happy we're having this conversation today, because people need to be aware that it's not the last bus stop. There's a lot of hope.
During Social Media Week, the speakers used science and religion in tandem to shine a light on mental health. And as you said, being a religious nation, Nigerians love to blame their suffering on the wicked auntie in the village. However, through brain scans, we see that there's a difference between the patient who has a healthy brain and that suffering from schizophrenia or bipolar disorder or depression even. So where then do we draw a line between spiritual and physical intervention in terms of causes and implementing treatment?
That's a very good question.
Thanks.
Like you rightly said, our belief system is richly ingrained in culture and religion. And let me talk a bit about the good sides. These religious views help us cope with the stressors, all the chaos going on right now. At least the fact that we have a support group from our religious circles helps. On the flip side, talking about the causes or the thoughts behind delusions, most of them have a religious context to it. People believe that there's someone chasing after them, and unfortunately, these thoughts are encouraged by the churches, and because we have become paranoid people, and
I'm sure that stifles treatment and effects.
It does, because sometimes people stop taking medication because they believe the pastors have told them that, look, just pray about it. We have to understand that these things work hand in hand.
Yeah.
There's none of them works in isolation. So really just pray, and remember we're here for a reason. Like I tell my patients, we should be grateful to the Almighty Father that He's made us doctors. I'm not saying that we're mini gods of some sort, but He's made us doctors to be available to take care of people who are sick. So,
much of the literature documents that 64 million people in Nigeria suffer from mental health issues. That's roughly 2 in 5 people. Therefore, that shows that more people than we realize are going through this. Going forward, how do you want to change our approach as Nigerians? What would you like Nigerians to know about this issue?
I believe we need to talk more about mental illness. We have to remove mental illness from that dark chamber we have secluded it to. We have to remove the shame and the mystery associated with mental illness. People have to understand that really, that there's hope after diagnosis. It's not the end. It's like any other illness. So there's help out there. So we need to become more aware, and programs like this would help the cause. So keep it up. Thank you very much, Vincent.
No, thank you for coming out for this. I totally agree with what you said, and I'm so grateful for this opportunity and for starting this conversation and hopefully inspiring someone out there and giving them hope, you know?
You're welcome.
Thank you for tuning in. I hope this has enlightened you guys as much as it has me. From here on out, dare to care and stop the stigma. I'm Different, and I hope to see you next time.